Deep within your brain, residing in a small bony cavity, lies a gland no bigger than a pea, but with a job of immense importance. The pituitary gland. Think of it as your body's master conductor, orchestrating a symphony of hormonal signals. It's the central command center for many vital bodily functions. This tiny but mighty gland is directing hormones that control growth and development from childhood to adulthood, regulating metabolism and energy levels, managing your body's response to stress, and overseeing the complex processes of reproduction. It's a truly multifaceted role. It sits snugly at the base of your brain, nestled within a bony structure called the sella turcica, constantly taking orders from the hypothalamus, the brain region that acts as its supervisor, and in turn, signaling other glands throughout the body to release their own hormones, creating a complex cascade of hormonal activity. But what happens when this delicate balance is disrupted? When it overproduces hormones, most often due to a benign tumor called a pituitary adenoma, a non-cancerous growth on the gland, then a variety of problems can arise impacting different aspects of your health. Macroadenomas, larger tumors, can press on nearby structures such as the optic nerves, causing persistent headaches, sometimes severe, and various vision changes, including blurred or double vision, especially bitemporal hemianopsia, a specific type of visual field defect characterized by peripheral vision loss. Remember, the specific type of hormone that is being overproduced by the pituitary adenoma directly determines the specific symptoms a patient will experience, leading to a particular clinical presentation, a key point to remember and understand for NCLEX questions and your future nursing practice. When the pituitary gland goes into overdrive, a condition known as hyperpituitarism occurs. This means the gland is producing too much of one or more hormones. But what does this hormonal imbalance actually look like in terms of symptoms? Well, the specific symptoms of hyperpituitarism depend heavily on which particular hormone is being produced in excess. Each hormone has its own target and effects on the body. For example, too much growth hormone, especially during childhood, causes a condition called gigantism. This results in excessive growth and stature. In adults, excess growth hormone leads to acromegaly, a condition characterized by the gradual enlargement of bones. Think big hands, feet, often requiring larger shoe and glove sizes. Also, jaw and facial features become more prominent, sometimes leading to noticeable changes in appearance over time. On the other hand, excess ACTH, or adrenocorticotropic hormone, leads to Cushing's disease, affecting the adrenal glands. This manifests as central obesity, with weight gain concentrated in the abdomen and a characteristic moon face. You might also see a buffalo hump, a collection of fat on the upper back, and purple striae or stretch marks on the skin. Furthermore, Cushing's disease can cause hypertension or high blood pressure and high blood sugar levels, increasing the risk of diabetes. Now, too much prolactin, another pituitary hormone, causes galactorrhea, which is the production of breast milk in non-pregnant women or men. It can also lead to menstrual changes in women, such as irregular periods or amenorrhea. High prolactin levels can also contribute to sexual dysfunction in both sexes, impacting libido and reproductive function. Regardless of the specific hormone involved, large tumors in the pituitary gland can cause a range of other symptoms. These can include persistent headaches, unexplained nausea, and classic vision loss, particularly affecting the peripheral vision. It's important to always link visual changes to potential pituitary tumors, especially when preparing for exams. Recognizing these patterns of hormonal imbalances and associated symptoms is crucial not only for accurate diagnosis but also for achieving success on the NCLEX. Diagnosis starts with blood tests to identify which hormone is high: GH, ACTH, or prolactin. MRI is the gold standard to locate and size the tumor. Treatment aims to lower hormone levels and relieve pressure. Surgery, transsphenoidal hypophysectomy, is the most common approach accessed through the nose for quicker recovery. Some tumors, like prolactinomas, respond well to medications such as cabergoline or bromocriptine. Radiation or additional meds may be needed if surgery isn't enough. After surgery, meticulous post-operative care is paramount. One of the first things we need to do is monitor carefully for any signs of CSF leaks. This is a critical assessment in the immediate post-operative period. Specifically, look for clear nasal drainage. If you observe any drainage, check for the presence of a halo sign on the gauze. This is a telltale sign of a CSF leak. To confirm your suspicions, you'll want to test the fluid for glucose. CSF will contain glucose, which helps differentiate it from regular nasal secretions. It's also vital to prevent increased intracranial pressure in these patients. To help manage this, keep the head of the bed elevated to at least 30 degrees unless contraindicated. This promotes venous drainage from the brain. Furthermore, avoid straining during bowel movements. We can achieve this by using stool softeners as prescribed by the physician. It's also important to watch for any signs of hormone deficiencies. Pay special attention to signs of adrenal crisis, which can be life-threatening if not recognized and treated promptly. Be vigilant for symptoms of diabetes insipidus. This includes excessive urine output and persistent, unquenchable thirst. Therefore, monitor urine output and specific gravity closely to detect any abnormalities early on. To succeed in your studies, know the key links. Understand the relationship between pituitary adenoma, hormone excess, classic symptoms, and the essential elements of post-surgical care. Mastering these essentials will not only help you ace the NCLEX, but also provide a solid foundation for your nursing practice. With a strong understanding, you'll be well equipped to care for your patients safely and effectively. So stay sharp. Your knowledge truly makes a difference in the lives of your patients.